Imagine, you're at a nursing home visiting a family friend when all of a sudden the resident that lives across the hall comes in frantically, yelling that y'all need to get out of his house before he calls the cops. Worried, you go to the nurse's station wondering what is going on. The nurse calmly reassures you that y'all are in fact in the right place, but the patient across the hall has Alzheimer's disease, and sometimes it causes him to be disoriented and agitated because he gets confused. Along with learning from these types of situations from working in a nursing home, I have also done research to help y'all understand Alzheimer's disease better. According to the American Health Assistance Foundation, 5 million are believed to have Alzheimer's disease today in America. So today, I would like to inform you all of the nature, symptoms, and treatment that goes along with this disorder. Let's begin with what it is. Alzheimer's disease is a form of dementia that is a progressive brain disorder and leads to memory loss, personality changes, and an ability to communicate. Alzheimer's can start either early in life or late in life. If it is started before the age of 60, around 30, then this is called early onset Alzheimer's disease. But this case is rare. If it is started after 60, then it is called late onset Alzheimer's disease. This case is, however, very common. The cause of Alzheimer's disease is unfortunately unknown, but there are 2 changes that have been found in the brain when autopsies have been done. The first one is an overproduction of a protein called A-beta. This protein forms tangles within the nerve cells in the brain and prevents messages to be passed on throughout the body. These tangles start to destroy the nerve cell and then lead to plaque, which is the second thing that is found in autopsies. This plaque is consisted of the protein and all the dead nerve cells. There are also 2 contributing factors that are commonly known with Alzheimer's disease. The first one is heredity. If a person has family that has been diagnosed with Alzheimer's disease, then they are more at risk for also getting Alzheimer's disease. The other contributing factor is gender. It has been found that women are 50% more likely to have Alzheimer's disease, with 1 out of 5 women being diagnosed. Now let's talk about the symptoms. A variety of symptoms comes with Alzheimer's disease. In the early stages, one might have slight problems with memory and with language. One may have problems with getting lost on familiar routes that they commonly take, or with tasks that they normally do, such as balancing a checkbook. They may also have problems with finding the right names for everyday objects that they use, such as a watch they may call a hand clock. In the later stages, these symptoms become worse. One may forget who they actually are and who their family members are. They may forget the history that they've had together and important memories. They may also become incontinent, which means that they have difficulties going to the bathroom by themselves. Given the severity of the symptoms of Alzheimer's disease, y'all may want to know what the cure or the treatment is. Unfortunately, there is no cure found yet for Alzheimer's disease, but there are treatments. One is medication. Medications have been found to try to slow the progress of Alzheimer's disease so that the stages do not come so quick. They also have found medications that helps with the behavior that is caused with Alzheimer's disease. The first medication helps to, one type of medication helps with the chemicals to keep on delivering the messages throughout the body so that the body can still maintain everyday functions that it normally would. The second type of medication are like antidepressants or antipsychotics, which help to eliminate hallucinations and keep the person from getting so agitated or so anxiety-filled. There is also alternative therapy for treatment. Although these are not guaranteed treatments or they haven't been shown in research to help, the Mediterranean diet, which is high in fish or in omega-3, has been shown to slow the progression of Alzheimer's disease and actually has been shown to help prevent Alzheimer's disease. Another form of alternative therapy is exercising, which helps eliminate the symptoms, or better yet, help the symptoms to not be so bad. In conclusion, the American Health Assistance Foundation has found that 15 million people in America by the year of 2050 are going to be diagnosed with Alzheimer's disease. My advice would be to spread the word to your friends and family about what I have taught you today, and try to enjoy the memories that you have with them, because you don't know when you may not be able to. Thank you.